Union and around 300,000 households. For the current presentation, a sample of 6,836 primates has been derived from the dataset and analyzed. Of all pregnancy is primates. Neonatal mortality rate among live births of primates is 23 per thousand live. National neonatal death rate is 24.4 per thousand. This is the World Bank estimation. Earlier one is our standard. %, primaries have secondary and above education, 43% incomplete secondary education, 9% no education. %, live births among primaries. This is the pregnancy outcome. Median age at first pregnancy, 80 years. Median age at first marriage is 18 years. 50 age at first marriage below 50 years or below is 16%, 18 years or below 72%, 20 years and below 88%, 21 years and above only 12%. Median age at first pregnancy, 19 years. First pregnancy below 20 years and below, 71%. 25% between 21 years and 25 years. 26 years and above, 4%. Mean space between marriage and pregnancy, 1.7 year. Median space, 1 year. At least 3 years space is found among 21% primaries. Less than 1 year space, 25%. We will share with you some crucial maternal and neonatal health indicators of primary. In a nutshell, we can share that in terms of core ANC by medical trained personnel, delivery by medical trained personnel, facility delivery, contraceptive use before pregnancy, PNC by medically trained personnel in 48 hours, newborn care in 48 hours by medical trained personnel, proportion in urban is substantially higher compared to rural. However, in terms of breastfeeding within 1 hour, urban scenario is little lower than that of ANC by FTP for primaries is 3. At least 4 ANC, 29% primaries have at least 4 ANCs, and no ANC by medically trained personnel 34%. We analyzed this data and came to the following inferences. The higher is the education level of primaries, higher is the chance of having at least 4 ANC. A primary with secondary and above education is 7.3 times likely to have 4 ANC compared to no education. Similarly, higher is the age at first marriage, higher is the chance of having 4 ANC. A primary from highest wealth quintile is 4.9 times likely to have ANC compared to lowest. Primaries with secondary and above education is 6.8 times likely to deliver at facility compared to no education. A higher age at marriage, a higher is the chance of delivering in facility. If someone got married at 27 or above age, she is 5.6 times likely to have facility delivery compared to a primary who got married less than 15 years. Primary from highest wealth quintile is 5.7 times likely to deliver at health facility compared to lowest. Higher is the educational level, higher is the chance of having NPP, having newborn care from medical trained personnel in 48 hours. Conclusion and recommendation. In spite of encouraging achievement in emerging service setting by primaries, still we need to go a long way. A 53% primaries in Bangladesh are still not assisted by medically trained personnel during delivery. Hence, a comprehensive mechanism needs to be devised to bring all primaries served by MPPs. Steps to be undertaken to further delay age at first marriage and age at first pregnancy. Steps also needed to be undertaken to further promote secondary and above education among girls. We thank the Ministry of Health, Family Welfare, UNFPA, UNICEF and WHO for facilitating the primary study. Thank you.
Can I ask you which was the time of the study? I mean, the data collection?
We collected data in 2013 and the data is for 2012.
So the data collection period was 2012 to 2015.
Data collection was made in March to June 2013, but data collected for 2012. We specially identify women who have pregnancy outcome during 2012, January to December. We listed them and
For those who had a delivery in 2012,
not only delivery, any pregnancy outcome.
who were pregnant for the first time in 2012.
So this presentation deals with women who delivered for the first, who have pregnancy outcome for the first time in 2012.
So that's why there are some more interesting parameters. No? Secondary education completed was 40%, age of marriage was 18 years, because BDHS 2011 still says that mean age of marriage was around 16. Any question now?
I'd like to what about all the teenagers pregnancy according to data and what are the teenage pregnancy? Teenager, how to prevent this one and what is the recommendation for this one?
Answer this on his behalf.
Let me try to share our findings. If we consider delivery at the age of 18 or below as teenage pregnancy, then about 44% deliveries occurred in that age. What's the question? Sorry.
Yes. According to this scenario, like then all pregnancy mother is teenager, less than 20 years, like 19 years, yeah. Median is 19 years. So, what is the suggestion or recommendation for this? How to prevent this pregnancy? All these things.
Two things we have suggested. One is to further delay or bring and increase age at first marriage. In case of early marriage, delay the age at first pregnancy, so that it goes beyond, it goes 20 years and above. It occurs at 20 years and above.
I observed in your study, the age of the women, it is higher in rural area, and their primary maybe the age also higher than the rural. And even the education age and the pregnancy is higher than the rural sector. So the area, the education, the age and the concept, so it differs rural to urban to.
Oh, actually, this percentage shows percentage of those who live in urban areas.
Right.
So, say if we consider 20 years and below, this line, 66% of primaries living in urban area are in the age group of 20 years and below, and 73% in rural area belongs to the same age bracket, age group. It's not actually the reverse picture. Anything, ma'am?
According to your data, we saw that the 44% of teenage pregnancy rate. So According to data, when you collect the data, what are the main causes of this rate? This higher rate, what are the main causes you face? According to history, when you collect the history and data, what are the causes you find that?
Early marriage, non-use of contraception, lower use of contraception after marriage, you see, 34%, while national CPR, use of contraception, is over 60%, something around 64%. CPR among prime is 34%. Obviously, a couple after their marriage, they like to have their child earlier, but this is too low. In context of Bangladesh and especially in context of early marriage, this is good. Are you satisfied?
Only early marriage. Anything else?
Education, again a factor. We have showed the higher is the education, the higher is the possibility, the lower is the possibility of having early pregnancy. Actually, we are sharing some of the key findings from our article, which will be published soon, where those aspects will be discussed elaborately.
Dr. Abhijit, for his nice presentation. So, in this session, we have 4 presenters, and they have discussed about different aspects of maternal and sexual reproductive health. For the first presenter, Dr. Tamzida, she has explained about the Manushi project. That's an excellent name for the project, Mahanirbhar and Shastra. And we have learned about how the private organization in collaboration with government as well is working. From the presentation of Professor Firdaus Islam, we have learned about the fistula prevention and curative program of government. And this fistula training center at the Medical College is a referral center for all types of fistula patients. And we can recapitulate what the madam has said, that fistula is the main cause of fistula is obstetrical malhandling, the obstructed labor, neglected labor. But there are other fistula patients who are sufferers from as a result of improper techniques used during different operations. But it's not always improper techniques, but maybe some patients say obstructed labor when he is having cesarean section, she might got a fistula afterwards. That is not only the sequelae of the operation. And there was a very excellent program that the cured patients are working as an advocate. So that is a very positive impact on the community. Then Mr. Amit Bajpai.
What is the difference fistula and White's or
Anus ulcer. Okay, fistula is, madam has said, it's an abnormal communication between 2 hollow viscers. I mean, 2 hollow organs, there's an abnormal communication. Anal fistula is an abnormality of the anal canal. The I mean, the opening, the anal opening and the skin. Next start with another hollow viscera or another organ. And the pipes is something which is, dilatation of or the stagnation of the venous circulation. So that's not a fistula. Ulcer is not a fistula. Fistula means rupture. Adult fistula